The Kogi State Ministry of Health has held a workshop on subnational cascade towards a rational, realistic, pragmatic and comprehensive plan that informs the health budget for the people of Kogi State. The Commissioner for Health, Dr Adams Adeiza, said the program is to bring the capable hands and the aim of the program is to boost the health sector in the states. He also commended the President of the Federal Republic of Nigeria, Bola Ahmed Tinubu, for the initiative of sector-wide approach SWAP in Kogi State. Let's join Faith Adike for more.
Kogi State government, in collaboration with World Health Organization, SWAP and other health agencies, took turn to educate participants on the objectives of the workshop.
The capacity building here is one of the major turning points for the state. If we get it right now here, it means Kogi will definitely make it in terms of their hub PLIs. And we know those indicators are very critical, especially the MIEs here and the other program officers. You are very crucial in this work. If we have a very quality AOP from that lower level, we can easily put it into practice.
Development partners, we are looking forward to look at the plans we've developed and see how we can partner together to ensure that the citizens of Kogi State and Nigeria at large enjoy access to better health as overall.
The State Commissioner for Health, Dr Adams, through the Director of Health Planning, Research and Statistics, Ministry of Health, Johnson Ayedebon, said the program aims is to boost the health sector in the states.
We are looking forward to seeing a very good health improvement in Kogi State based on the commitment of our leaders and the strength and the commitment of our health workers in this state. Kogi State has always been doing well and will continue to improve on this commitment so that the health output of Kogi State will be better for it.
He equally commended the state governor Ahmed Usman Ododo for his commitment to the health sector.
We also especially appreciate the effort of the state government under the leadership of His Excellency Alhaji Usman Ododo, who has been very committed to improving the health outcome of Kogi State. In all, he has provided a very good environment for the implementation of health programs. He's committed and he has been committed to funding all health available programs.
The desk officer of the sector-wide approach SWAP, Dr Nigeria Bola Ahmed, said the workshop is to train program officers and to strengthen their capacity to build more.
The workshop emphasized in strengthening their capacity in both health system, strengthening methodologies, problem solving, data for informed decision, leadership, and so on and so forth. And our aim is to ensure that this crop of leaders have their capacity built to be able to manage health interventions at all levels. We want them to be able to plan activities that are smart, that are very realistic, very achievable, that can be able to be used for our people in Kogi State.
Dr. Emmanuel commended the Commissioner for his commitment as he listed out the participants who are present at the workshop. He advised the participants to put into practice the knowledge gained at the workshop.
I want to appreciate the Honorable Commissioner for Health that is providing leadership, in the health sectors and has been able to bring everybody, galvanize everybody together. His name is Dr Adams Adeiza. He has brought everybody together, selected people that are highly technical and highly driven with passion for the state to be able to carry out this assignment. As you can see, everybody here, they are motivated, they are well driven, and they are prepared to carry the job and the task ahead. And the aim and the goal at the end of the day is to improve our health outcome so that our maternal mortality rate is reduced at the end of the day. Child morbidity and mortality is also reduced at the end of the day.
Facilitators told participants on best practices and promised their adequate support.
We discuss leadership. Leadership is not just the person at the head of the table. Once you are at the table, you are a leader. And we are all at the table here. you need to demonstrate leadership.
Everybody is contributing to that plan now. We are going to take ownership. Our donors have made a lot of statements. It's not business as usual. Donald Trump has shown us that he's withdrawing funds. So it's our responsibility, me and you. We are the owners of our work. We are the indigenes of the state. So whatever we are putting here, if anything goes wrong, all of us are going to be held responsible.
Participants expressed their joy over the workshop and promised to extend what they have learned from the workshop to their various local governments.
From what the previous narrative to a new level, we have seen that putting everything together in one report, one budget, one conversation, one voice is key in ensuring that we get to the grassroots and give our people quality health.
Thank so much on AOP development and productions. So, and I'm very hopeful that when I go back to my LEGA, I will be able to cascade what I have learned here to my other LEGA team.
The State Technical Officer of the Association for Productivity and Family Health, Joseph Mpama, and the Executive Director Initiative for Grassroots Advancement, Hamzat Aliu, and others who spoke at the event, said it is a welcome development and promised their collaboration.
Well, at the state level, several meetings were held, some even at the EOC, to ensure that they were reviewed and presented in a form that people could interact with. I just want to state that I bring greetings from my program director, Dr. Adams. She's very much aware of this particular program and she'll be reaching out to you for other ways of collaboration. Thank you very much.
Most of our public health issues will no longer be funded by donors. We had always cried that the state should take ownership. And the Trump administration has shown us clearly that we are past midnight. We've gotten to a point where we need to begin to think for ourselves.
The workshop has in attendance the national representatives and 65 participants cut across all the 21 local government areas of the state. Faith Adike reporting for MSC TV.